Dr. Dana Selby here with Allison Baker, third-year kinesiology student at Guelph Humber, and today we're going to be going over a series of exercises for the muscles on the outside of the hip. These are called the gluteus minimus and medius, and they are the muscles that predominantly perform what's called hip abduction or abduction. That's movement away from the midline of the body. This is a very important muscle group for hip stability, especially when we're standing on one leg, which does happen through the normal walking or the gait cycle. Especially older people who want to avoid hip issues, keep these muscle groups strong. So we're going to start with side walking with the TheraBand. You can see that the band is tied around Allison's ankles. You might need to increase the resistance or decrease the resistance depending on your level and strength of your glute muscles. Now this is a red TheraBand, which denotes a medium amount of resistance. Different types of bands, in terms of name brands, may have a different color code, so pick the band that works best for you. Now Allison's going to start with her toes turned inwards, pigeon-toed. If your toes turn outwards, it's going to hit the front of the hips more. Whereas if you turn your toes inward and keep them inwards, it's really going to hit that glute min and glute med. Now when Allison does this side walking, she's going to have a bit of a bend to her knees. And she's going to maintain the same degree of bend throughout the duration of the exercise. She doesn't want to bend and straighten her knees and bob. You're going to keep your shoulders right over your hips and relax through the upper body. So Allison, I'm going to get you to start walking to your left, please. So she's going to take a step out. You can see that there's quite a bit of stretch on that band, a good degree of resistance. So she's got to control that motion with the right leg coming in. Okay, go ahead. Really good pace, and we can see that both of her toes are nicely turned inward. She's got a good amount of internal rotation. Now, she's going to go as far as she can in one direction with good form, then she's going to walk in the opposite direction. So now stepping out with the right and following in with the left. So the foot that follows really has to control the degree of resistance of that band. Go ahead again, please, Allison. Very good control here. You'll be able to feel this on both sides of the hip. Now, if you're finding that you're feeling a little unbalanced with this exercise, because it's a very unnatural way in which to walk, a hallway works very well because there's a wall behind you and in front of you. And you can even get right tight to the wall and let your hands brush against the wall. Not supporting yourself, but literally letting your fingertips brush against the wall if you do feel that you're unbalanced. Now the next exercise is going to be a standing single leg hip abduction. So Allison's going to face the wall with one side of her body, and you can put your hands on the wall, but again, you don't want to have the wall there for a lot of support. You want to just feel that your hand is barely touching the wall, and in fact, if you've got the balance for it, you don't even have to touch the wall. Now the support leg is going to have a little bit of a bend to the knee, protecting that knee joint, and she's going to have her weight on the ball of the foot. So you want to make sure you're right across the ball of the foot. Don't sit back on the heel. Now shoulders are back and down, nice tight abdominal activation with the core, and her left leg is going to be turned in. She again wants to keep that toe pigeon-toed, so she really hits the outside of the hip. The toe gets turned forwards, she's going to be hitting more the front of the hip. Okay, go ahead, Allison. So as she goes out, she's going to stop, hold 1/1000, then she's going to come in with control. And she's got a really good balance on this right leg. Her hand's not even touching the wall, but you can have the hand there for support if required. What you don't want to see is leaning into the wall as you push out with that foot. Now, typically speaking, every few repetitions, make sure that your foot is inwards, good, in a nice pigeon-toe position. Now you're really going to feel this on both legs. Obviously the leg that's working, in this case the left leg, but that support side, because the glute min and med work when we're standing on one leg are really going to be working on that right leg. So once you've done as many as you can with good form, you're going to turn around and perform that exercise again. So take a little bit of a bend on that support knee, turn in that right leg, and you're going to abduct out straight to the side. Stop, hold 1/1000, and then nice and controlled on the way in. If you find the resistance is too much, just loosen the band off a little bit. Or conversely, if you want to make it more challenging, tighten the band up a little bit. This is just tied with a bow, not even a knot, to make it easier to undo. Now, we can also perform this exercise in a side lying position. So Allison, can I get you to lay on your side, please, facing the mirror? Now, if you support yourself with your elbow, you want to make sure that you've got vertical alignment of the elbow under the shoulder. So bring your elbow out just a little bit. And you don't want to hang on the shoulder. So just hang on that shoulder for a moment, Allison. You see how none of the muscles are supporting that shoulder joint? Over time, it's going to put a lot of pressure through that shoulder. So Allison's going to engage your muscles and support around that shoulder. If you don't want to rest on the elbow, you can relax right down on the side of your body. That's just fine. Now we've got a good straight body line here. The top leg is going to be working, so it's turned inwards towards the ground, really concentrating on hitting those muscles on the outside of the hip. Now Allison's going to go straight up to the ceiling. She doesn't want that leg to move forward. She wants to maintain a good straight body line. Go ahead. So she's going to stop, hold 1,000, and then she's going to lower with control. Really resisting the pull of the band. Go again. Stop, hold 1,000, and lower with control. And she's going to do as many of these as she can with good form. And then of course she can flip to the other side and work the opposite leg. Now if you lay on your back for me, please, Allison. Allison can do a double hip abduction when she's laying on her back. The only thing with this is it can cause your back to arch. So if you put a hand underneath your back and over top, keeping that core engaged, this will make sure that she does not arch her back as she spreads out both legs. So you can see her toes are turned inwards, she's pigeon-toed pointing to each other, and she's going to stretch both legs out, abducting both legs, and then nice and controlled. Now, she did lift her legs up, and that's okay to really increase the activation in the lower abdominal area, but that's quite advanced. So if you find that there's any pain, you can just keep your feet in contact with the ground and just skim over the ground. Stop, hold 1,000, and nice and controlled on the way back. Stretching it out, go ahead. Stop, hold 1,000, nice and controlled on the way back. If you get back pain with this, don't do it with both legs at a time. Lay on your side or do it standing. Do not compromise your back trying to strengthen up the hips. If you do have any questions, leave a comment below and we will get back in touch with you.